Can you tell me what are the experiences of Viva today that we have experienced during your PG, UG, or what you are taking as a teacher?
Ma'am, the other side of the table is always exciting, but when we became the students, then it is anxious moments. What is being asked and what we are going to be answering. But when we are asking questions, then it is exciting to know what the student knows. So it depends on which side of the table we are sitting.
Anyone else? With that excitement comes a satisfaction.
Ma'am, more than satisfaction, it is introspection that how we have built our students.
Okay, that's your experience. Anybody else? You have to answer. Shilpa, don't close your video.
Yes, ma'am.
What's your experience?
Ma'am, if we are, yes, ma'am. When we give answers confidently, then it is fine, ma'am. But first two questions, if we don't answer, then it is a quite questionable experience, ma'am.
As a teacher?
As a teacher, we would know exactly how the students are. So we know exactly what matter to extract from the student.
What about the time given to every student?
Time, it varies, ma'am. Some students, they take very it's a long time to answer, and some students, they might know the answers, but they may not exactly expecting what to answer.
In a batch, how many students are there?
In a batch, it's 50, 50, 50, 50, 100, ma'am, around.
No, no, at a time for Viva.
For Viva, it's around, we will have to take 21 day, we have to take 20 students, ma'am, 20 to 25.
And about 3 hours for each student.
Uh, it's including practical and Viva, ma'am, both together. Within 3 hours, they have to complete the procedure also, and for Viva, some extra time will be given for the students. In some colleges, they have to finish within 3 hours both Viva and practical exams.
Yeah. Okay, how many are joining more? You have no idea how many are joining?
Ma'am, Meenakshi ma'am, I think she has a meeting NAC
She called me a
inspection and
person.
all.
And one
Yes,
more
ma'am.
person, Sandhya, told me she's not joining. What about
Yes,
others?
ma'am. Padir sir and Anand sir,
Uh,
Jyoti ma'am, and Mirna ma'am.
so my first candidate is Siddharth.
Yeah, madam.
I am taking a Viva for you.
Okay, ma'am.
Okay. Um, can you define centrifugation? You don't have to answer exactly, but I am asking you questions. Try to.
Madam, I'll try how we receive answers now. Madam, according to GPT-10, the posteriormost position of the mandible, uh, exact definition, madam, if I have to recollect, then I'll take time.
Okay. Okay, can you say what the difference between hinge joint and rotational joint?
Hinge joint, madam.
Ah,
Madam, rotational joint movements are those movements once we cross beyond 15 degrees of mandibular movements, we go ahead into rotational movements, madam.
okay. Any other joint has rotation in the body? Okay, tell me about. Just define prosthodontics.
The art and science, prosthodontics is that branch of dentistry that deals with the replacement of missing teeth and its associated structures with artificial substitution.
Okay, I don't think you know. It's time up, so I'm going to Arun.
Okay, okay,
Arun,
madam. Arun sir will answer
Arun,
with
define major connector.
The major connector is the that part of the removable partial denture design which connects the one side of the arch to the another side.
What are different types of major connector?
Ma'am, major connectors can be classified based on the arch, maxillary, and mandible. In the maxillary, we have six major connector: full arch, horseshoe, double palatal strap, palatal bar, major connectors.
Arun, what is an implant?
Implant is an artificial insert which have been inserted into the body to be accepted as a part which can be used in future as load-bearing structure.
Okay, have you ever seen an implant being placed?
Yes, ma'am. I have seen and I have placed, ma'am.
As a final year BDS student?
I have seen implant being placed, ma'am.
Okay, have you heard of aesthetic partial denture materials?
Yes, ma'am. I have heard of commonly used aesthetic materials which can be used to create aesthetics for the fabrication of various processes.
Heard what? Name them.
Ma'am, broadly we have composites, ceramics, other the
No, but
broader
ceramics
categories.
cannot be used as a partial denture materials.
No, the teeth, the material
Okay,
which can be used as the artificial teeth.
I'm talking of denture base. Okay, give me a
No,
minute.
same anxiety is there still yet, sir. So where madam is asking, same anxiety is there. Nothing has changed. It's just that the way it is.
no, she is
We are
going
only
to ask
for
us.
What was I asking you? I forgot, Arun. Can you tell me about stem cells in prosthodontics?
Stem cells are the newer advancements wherein it can be used in the replacement of the missing tooth. The research is in still infancy and not have a very good
I don't think
result.
I don't think you have studied, Arun. And I think in the final exam, the Viva marks out of 20, I don't think so. It is possible that you will get good marks, both of you. Okay? Okay, now stop. Now, Shilpa, debrief.
yes, ma'am.
What did I do? Was there any new
Ma'am,
thing beyond
you
the
have
pattern?
no, ma'am.
I just asked questions what came to my mind, and I asked all
Yes, ma'am.
difficult question to the second candidate. Okay?
Yes, ma'am.
And I was an interruption. Somebody came to give me coffee or something. I went. What
Yes,
else?
ma'am. And you are asking in general questions to Siddharth sir, and you are asking particular questions to
I
Arun
asked
sir.
general questions. I also asked him define centric. In fact, it's a very basic thing.
Yeah.
Yes, ma'am.
Yeah. Okay. So I asked him, but okay, GPT-10 and all, he used the words, but he could not. But I interrupted him and cut him.
Yes, ma'am. Yes, ma'am.
Okay. And what about Rohit? Can you add one extra point? I can't hear you.
रोहित तेरा माइक बंद है.
Yeah. Ma'am, I was telling, we have to give them little more time, or we have to help them little bit hint,
No, I
so
gave
that
2 minutes to Siddharth, and I think I did give about 4 or 5 minutes to Arun.
yeah, ma'am. I
Am I
think that
right?
they know the answer, but they require little bit hint also, so that it will
Madam,
be
even
easy.
though
You think in exam we should give hint?
No, no, ma'am.
Okay, let me start. Share the screen and start the presentation. And by and by, I want you to participate. This is most of the Anand, you are in the clinic.
Yes, madam. Just reaching the clinic in 5 minutes.
Okay.
Yes.
So I am starting with structured Viva. I took Viva of Arun and Siddharth, and I'm not satisfied with both of them. Anand, what do you say?
Which one, madam? Viva?
I'm taking their Viva.
the same anxiety is there,
I was
not
feeling
miscommunication.
like a student life, madam. In fact.
Let me share.
Yes.
Can you see my slide?
Yes, madam.
Not yet, ma'am.
Not
Completely
yet
see.
started, ma'am.
I started.
Black car, madam.
ऐसा कैसा ब्लैक आएगा यार?
मैम आई थिंक आप क्लोज करके दोबारा रिस्टार्ट करिए क्योंकि मल्टीपल विंडोज आ रहे हैं.
Can you see? अरे can? Huh?
Ma'am, blank screen.
What about this? All right. So we are going to see about assessment of. You want me to have the full screen?
Yes, ma'am.
Yeah. Assessment, but all of you have to be active today. Huh? Half of the slides you are going to read and discuss with me. Assessment of oral examination for maybe here dental students. You can have a conventional Viva OC examination, or you can have a structured Viva OC examination. We call it SOE, structured oral exams. Okay, we had a role play research just now. I asked questions to two people, but one I asked for 2 minutes, other I asked for about 4 or 5 minutes, and I asked difficult questions to one person. but he other person I asked simple questions, okay, and both of them irritated me, okay. So we debriefed and we came to know that the time given was not same to everybody, both the candidates. There were so many other things. So let's now talk about the current oral exam. Does it cover all the required domains of learning, knowledge, skills, and attitude? Because attitude can be also tested in OC if you are structuring the questions like that. तो the students feel अरे अरुण आ गया एग्जामिनर तो ये यही क्वेश्चन पूछेगा. Everybody he will ask about fixed partial denture and some definitions. And if Shilpa is examiner, she will be asking about complete denture prosthodontics. And where is the patient in this prosthodontics? Complete denture patient, what do you mean? The complete denture is meant for the patient. Patient with a completely edentulous arch or completely edentulous upper and lower both. So let's talk today about the SVV pattern structured Viva OC exam, whether it is reliable and valid, and to give equal opportunity to all these students. That is the motive. So the aim today is to encourage the faculty to use this method of SOE, structured oral exam. I like to call it SOE, but if you have to Google for the keywords, it could be anything, structured Viva OC examination for healthcare profession, or it could be SOE or whatever. And to increase the understanding of the subject to the learners. We want the learners, the students, to understand the subject by helping them to know. Just a minute, please. Yeah. जीवा वो अहमद के बाजू बैठे थे. So Ahmad is coming on the first tomorrow, day 30. ये text कर. I am in a lecture. Okay. Sorry for the interruption. So we want to provide a standard, appropriate, professional way of assessment and make the maximum use for to improve the students, learners' ability to understand the subject in even a formative viva. So how do you use the assessment? As learning, for learning, of learning. When I'm testing and you're learning, it is what? Assessment to help the students to learn, for learning or as learning. Are you with me?
Yes, madam.
Yes, ma'am.
अरे तुम लोग थोड़ा बीच बीच में आवाज करो, otherwise I'm not able to see you at all. This is not a very good way.
Okay, ma'am.
To improve the performance in subject during the oral exam, we want to train them also to speak because our field involves interaction with the humans. In the olden days, the Gurukul times, it was always the teacher asking the students to recite, teacher asking the students to meaning of the shlok. So it is understanding, comprehension, and even he wants them to introspect and see how it can be used, even evaluation. So they used various methods, and the teacher had a one-to-one relationship. Yeah. So they had Guru as the overall, and the Gurukul system was very good. because the teacher knew the student one to one. Teacher knew the student's habits, his way of learning. Over a period of time, we developed written examination and practical examination. And Viva VOC just became a small part of the formality and is not being used so well. So the word Viva OC is a German word and it's a practice in many schools and disciplines in which an examiner poses questions to students and students respond. Is there a disturbance?
Ma'am,
Somebody
too much noise is here.
म्यूट कोई कर सब लोग करो म्यूट an exam abhi it's okay na because actually when I am speaking if one more speaker is on nahi chalta hai an exam consisting of a dialogue is giving space to each other to speak. I did not make it as a dialogue. I made it as a monologue with Arun and also with Siddharth. I gave little opportunity to answer, especially to the first candidate, Siddharth. Before he could know, okay, next question, okay, next question. And after 3 questions, I got fed up that he doesn't know. I mean, these are all I presumed. I didn't go deeper. Who asked questions to which candidate and how it can be replied? The 4 examiners in the 2 examiners. How do you structure it? We'll see it very soon. You have to probe higher order of thinking. And sometimes interrelated questions need to be asked to go for a higher level of knowledge. Help if I ask define centric relation to certain students, if I can ask different methods, which is the method of choice and evaluation of the method, something like that, to make them think and to help to assess other competencies as communication skill. I'm also testing their communication skills and professional attitude. How the students pleasantly wishes, how he comes and sits, and how confident he is. Does he only show hand action? Have you ever seen the students making all hand action? Up and down and here and there and coming in front of the table, keeping the hand on the table. Certain things we need to inculcate the habits. Are you with me?
Yes,
अरे
ma'am.
Yes, ma'am.
ए तुम लोग सोने का नहीं.
नहीं मैडम.
हाँ, very good, very good. So who will read this slide? Anand, start.
The oral Viva was is focused on comprehension, application of the basic knowledge and concepts, and its implicit logical confirmation. It is precisely
Do
what
we allow that? Do we allow the implicit logical confirmation whether he knows? He has a comprehension ability. We focus on that, maybe recall and comprehension, application of basic, how we will apply, and how the various concepts, theories. Prosthodontics is full of concepts and theories, isn't it?
yes,
So how will you confirm that
Yes,
you
ma'am.
have understood why, the equilateral triangle, the all those things, what we taught them regarding certain things. Uh, I don't know whose mobile. So it is precisely analyzing, creating, evaluating the real depth of the knowledge in the higher levels. So asking a simple question from knowledge to comprehension, then analysis and application, and I may skip synthesis and evaluation except one question. If I have decided that we will ask 10 questions for a student, every student should be asked 10. 5 me and 5 my co-examiner. Let's see if that is happening or not. Most of the times, some of us are very dominating. So, in the formative assessment, we gather information about students, how they learned, so that we can plan our lesson better and to track students' progress. But in a summative, it shows what the students have learned at the end of the lesson or unit of the study and to provide evidence of what the students have done. So our motto is here, not here how they have learned. How they have learned, you can, if the students don't understand something, you can change it in the formative exam. But in the summative, it shows how in the college we have taken ahead our teaching learning methods and encourage the students to understand and learn and focus. So when we have cognitive domain, communication skills are equally important as your theory, your memory, your reasoning, your professional competence and understanding. The purpose of the oral examination is to test him, not only understanding and memory, but his reasoning ability, his ability to express himself. Teachers need to express them in the right way so that students understand. And ability to perform under stress, but not take what is a good stress called as eustress. The stress that is harmful, he cannot answer, he is blabbering, or he is, all the words are stuck up. That's not good. But because tomorrow is exam, I'm studying systematically. That is a stress which is a good stress. And ultimately, he becomes a professional. Again, the rotation because new knowledge keeps on coming, and we have to be a lifelong learner. Come on, read Mirna this slide. Okay, Shilpa, start. She's not there.
Yes, ma'am. Yes,
Yeah,
ma'am.
ma'am, I'm there.
In the under,
Ma'am, should I read the one?
Yeah.
Yeah.
Slowly, as if you're understanding, I'm going to explain the slide.
Okay. In the undergraduate medical education system in India, the curricular guidelines of the DCI of India lay general emphasis on various methods of assessment of knowledge, skills, attitude, and communication. These are the 6 levels of Bloom's taxonomy. First is the knowledge. Recall the information. That means whatever the students has read or previously, how much these are the basic question whether the student is able to answer or not by recalling whatever that person has read. Second is we should focus on the comprehension. That is the understanding. That we should poke little bit more to the applied aspect, whether the student is able to apply the theoretical knowledge. These are the indirect question and able to answer the question. Then comes the applications, using and applying the knowledge. Oh, I got confused, ma'am. Application based. The fourth one is the analysis, that is identifying and analyzing the patterns. That means these are the questions where the data are given and the students have to. I don't know, ma'am. For the modified essay question, this type of analysis are okay. Like, but here in the Viva,
Can you give him a cast and ask him to plan a partial denture and ask
yeah,
him
yeah,
reasons? You can do.
yeah,
He's
yeah, yeah.
identifying the missing areas, the missing teeth, and also the soft tissue. You're giving him some sort of a history on a paper.
Fifth one is the synthesis, that is using the old concept to
We
create
don't
the
go
new
much in
idea.
detail for synthesis and evaluation for a UG student, but for a
Okay.
PG, yes, because we have the Viva for within us almost 40 minutes to 30 to 40 minutes we can ask him questions. Last line.
Okay. One interesting method that can be used to make sure that all the 6 levels are used to create the assessment based entirely on the levels of the Bloom's taxonomy. That means if you follow the Bloom's taxonomy, we can ask the student the Viva gradually starting from the basic level to higher order thinkings.
So Mirna, in these
Yes.
6 levels, we have to identify the questions from chapters. We have to make sure the questions are valid and reliable and create even a question bank for Viva, isn't it?
Yes, ma'am.
Okay.
And
So
ma'am,
this is what I
suppose
wanted to show you. Can you read? Go ahead and read, Mirna. Understanding. Recall se chalu kar.
ma'am, just a minute. Ma'am. Actually, I'm reading from mobile, so it's a bit.
Okay, Shilpa, can you go ahead? Shilpa. Shilpa.
yes, ma'am. Yes, ma'am. Uh,
In the knowledge questions, what will you ask?
in the knowledge, ma'am, we will have to ask for the recall
Listing,
information.
locating, naming, defining.
Yes, ma'am.
These are the verbs.
Landmarks.
And
Yes,
in
ma'am.
comprehension,
In comprehension, whether the students is able to uh,
अरे इधर है ना
translate
देखो,
from that.
Uh,
there is a
Yes, ma'am.
slide which is showing summarizing, demonstrating,
Summarizing and demonstrating and
okay,
discussing.
and
And
also
then application. In application, using and applying the knowledge, using the problem solving
so
methods,
you
and
can design, you
manipulating,
can
discussing,
design
designing, and experimenting.
and analysis. Similarly, you can frame the question.
Analysis.
That's what I wanted to show you in this slide. So in the traditional Viva, used as a mode of assessment for many years. And at the end of the practical, when the students are done with the Viva, हम question पूछते हैं, is it true or not? Is it not many a time subjective, difference in time, difference in the levels of question? The examiner just comes without any Viva cards. Okay, close your, mute yourself, Shilpa.
Yes, ma'am.
Rohit,
Yes, ma'am.
can you read the slide from the third point?
Yes, ma'am. Usually, a subjective test, at times, it can be threatening to the student. More emphasis is given on comparison between a student rather than individual achievement. Often fails to assess properly the cognitive and problem solving skill, which is mainly aimed at in oral exam. The
This
examiner
is
may
the
discriminate.
problem solving skill that you can encourage the students to.
Yes, ma'am.
Huh.
The examiner may discriminate on the basis of ethnicity, minorities, economic status, sex, or even influenced by dress, personality, and verbal style of the candidate in vice versa.
Yeah. So does it happen?
Man, sometimes
Almost,
it
ma'am.
happened, ma'am.
Yeah.
Sometimes even,
Sometimes it
yeah,
happens. But if it's
sometimes it
sometimes it
happened.
is me and you, it is unfair for the
Yes,
entire world, we will say. And it happens many a times. Just looking at somebody I don't like, or maybe there has been sexual discrimination. In the earlier days, there have been cases of molestation during the Viva because the teacher who was anatomy teacher, if he wants to ask the muscles of the thigh or the gluteus, he cannot show put his hand somewhere and show. And this has happened really, and a student has complained. And also, a minority or an ethnicity coming from a small village cannot speak English doesn't mean he fails. It means that the college has not encouraged him with the language skills in English. It means, yes, I mean that. So we must have a language lab in every college. Okay, he doesn't understand at all. Then he requires to be explained what he does not understand. Repeat impression. Very vaguely, student doesn't know what to repeat. Midline is not coinciding. The student says, Madam, after 10 minutes I showed the teacher, he said it's coinciding. I had not done anything. So it should not be subjective, it should not be discriminating because everybody has equal opportunity. What is being measured in conventional oral examination is recall facts almost 70-80%. Define this, show this, demonstrate this, something like that. Not even demonstrate, identify, that's all. Less than 20% is interpretive skills or sometimes zero, and problem solving lesser than that. The serious doubts arise for using the conventional exam. So, how reliable and valid are these traditional oral examination? They're not. Are they valid? Sometimes the questions can be valid, but the marking system is valid. The discrimination that we do, asking a difficult question to one person and another person in the early morning, I'm in a very happy mood, giving more marks. is not at all valid and reliable. One examiner usually announces the grade and the other either agrees or disagrees. When the student goes, you know what I do for the first four exams? I will not, students, I will not mark. But the fifth question, I start marking. These four students have been very brilliant. I set a standard. And then I say that everybody should come to that standard. I have not done the individual examination of everybody to set up a percentile. I have not discussed with my co examiner what is pass and fail. This is a very gray area in our profession because it cannot be this side or that side. If he doesn't know, Nitin, te chavi hai. If he does not know certain basic principles in patient management, it is 100% no. But would you declare him fail in today's circumstances with the management pressure and the pressure from the competition with other colleges? It's just not possible to fail so many. So it's a better to ask Viva in that way for formative examination. Use it as a formative examination tool. Comparison between grades of oral exam and marks on written exam have low correlation coefficient. Studies have been conducted. In theory, the student gets almost failure marks, 45 like that. And in oral examination, because the candidate is from my college, I have taught the subject out of 2018. Is it reliable? Answer.
No, ma'am.
Not ma'am. No, it's not reliable.
Yeah. So can you read, Arun?
Demerits of conventional oral examination. It lacks standardization, objectivity, and reliability of results. Possibility of abuse of personal contact, language barrier, factor for poor performance, unavailability of enough adequately trained examiners, test questions and student responses go unrecorded, inexpensive, the professional time and information yield, atmosphere of the exam is often threatening and at times the dialogue takes the shape more of disagreement than cooperation. Non-uniformity of questions, gender bias and lack of subject coverage as well as high anxiety and poor validity of COE, conventional oral exam.
Okay. So, how can the oral exam be improved? It can be structured, organizing, organizing it with putting efforts to elicit the students their cognitive, problem solving, interpretive, and decision making skills. It is possible for us to make them understand their skills and to ensure higher degree of validity, reliability, and objectivity. At the same time, it does assess effectively the attitude, communication, and see, just because a student initially is rude, is a young student. So in the I have the opportunity to train him during my formative or maybe terminal examination or whatever internal examination, etc. And I can always conduct a class common to all regarding how communication skill, ethics, professionalism, all these things are important. About the affective domain doesn't mean he cries for a patient, condition, but he is empathetic to give him different treatment plan. Don't think about the second best. Give him all the options. You just be the patient is from the slums, madam. I cannot give anything but oral. The flippers or the partial denture, removable partial denture with resin. So these discrimination, these things should be taken a common exam for the students because this is how he is going to work in his clinic. So how can I structure it? Careful selection of examiners who have been trained. Who has not read? Who has not read?
Madam, I am not read.
हाँ तो चालू कर.
How can the oral exam be structured? Careful selection of examiners, pairing a new examiner with a more experienced person, briefing sessions for the examiners, providing the examiners with written instructions, atmosphere, creating a non-threatening
Also
environment.
use your environment, making a friendly and equal opportunity environment. If a teacher appears very, very rude and strong and he's known, the seniors tell, Arey, he comes so he will fail everybody. So these are the things which we don't want, right?
Then, madam, equal duration of time for each candidate, starting with easy topic, then proceeding to more difficult problems, shifting the topic if someone fails to answer in one area.
Currently, you would say, ah, okay. So these are the things which we can definitely structure. Answers and scores are noted by examiners for each candidate individually. A feedback given can be given during the formative exams. How can they score better and do well? At the same time, we need to assess effectively the attitude, communication power, and convincing power of the affective domain. How do you break a bad news that you have got a oral cancer, or maybe your condition is such that we need to extract a few teeth, it's anterior teeth for a young woman, or maybe some other thing. So, this is possible only when this tool is used thoughtfully, rationally, objectively, and relevantly, and giving a timely feedback. It's very important to give timely feedback. How he performed, was the part of the lesson, the cognitive domain he answered can be shortened or he answered properly. Whether his attitude, his ethics, his professionalism, communication skill was okay. Immediate answer, feedback should be given. Okay, now again start. Who will read?
Madam will continue.
Yes, ma'am.
Continue. Shilpa, Shilpa, come on. Why Jyoti
Yes,
doesn't
ma'am.
want, man? Okay. See, total
The
time for a structured Viva is 10 to 12 minutes. If you fix this and agree with the examiner, then it is equal time for everybody. Shilpa.
so the total time for uh,
Structured Viva
the
voce.
structured Viva was exam is 10 to 12 minutes, is fixed, spread over 2 days. Core content of the syllabus, different set of question cards are prepared, each having 8 questions.
So
So,
Viva
ma'am,
cards
do
are
we have?
prepared. Viva cards, how to prepare, I'll show you that.
Okay, ma'am. Yes, ma'am.
Having similar structure,
Then,
mutually agreed by all the faculty in the department.
yes, ma'am.
Then each question.
Then set of question cards having a similar structures mutually agreed by all the faculty members of the department. Each question split into 2 parts. The second being the leading question of the first, exploring their level of understanding of the first.
Yeah. So I said,
Okay.
first recall, then
Then the
application.
second leading.
Uh,
Okay. And then the second leading question is only asked if one had given the right answer to the first question, but not the vice versa.
uh,
Okay. Then the arrangement of the question as per the increasing faculty level and assessing the higher cognitive domains of learning. Every effort is made to frame the questions to be clinically relevant and to avoid overlaps with the theory questions.
okay.
Ma'am,
Yes.
ma'am, ma'am, it's the leading questions also be prepared in the Viva voce card. That means you have a first question, then the leading question is also being prepared and kept ready.
Yeah, you will see that. Arun, as we go ahead.
All right.
Huh. So we have some must know areas. We have some nice to know areas. and we have some desirable to know areas. And the line between them, the boundary between them, is not agreeable to everybody. Somebody told me that overdentures are a desirable to know area. I don't agree to that. Today, overdenture, even a BDS person should know in the practice. Okay, altered caste technique, even if he has a like answer where I mean the knowledge wherein he knows the lab does it for the crystal extension partial dentures, we would be happy. But we ask a full question on altered caste, and I'll, as I go ahead, I will express some of the things what we can change as a faculty. Okay, so there are these are the three areas: must know, nice to know, and difficult to know. You may not agree with me, and I don't agree that die is a nice to know. Die is not a nice to know. For me, many of these questions are must know areas. Okay, classify the different die systems and all may be nice to know. But how the die is importance of the die, what is the die is a must know. Okay, so these are the areas we need to come into the meeting with the faculty in the department and the examiner, external examiner, and come to know that these are the cards I have prepared. Please, can you also contribute from your college the cards? The candidate among a box of questions of say 20 questions in must know, 20 questions, maybe 30 questions is must know, or 50 questions in must know, 20, 25 each in desirable to know and nice to know. The candidate picks up from MK first, and again he picks up from MK. Then he is asked to go to the other areas, NK and DK. Okay, so the examiner himself doesn't know which he's picking up. Is not there a structure there now? More valid? Yes or no? सब
Yes, ma'am.
सब चलेगा है क्या?
Yes, madam.
Yes,
Examiner
ma'am.
now reads the questions the student has selected. He repeats it if necessary. Then he gives it to the candidate. The candidate also reads the question. There is no clues offered, no cues given. And the candidate answers maybe in a few seconds. He organizes his mind and answers the question. The examiner has a big card, master card, where he has placed that this card is already picked up. There is a scoring related to the boxes. For that particular candidate, he knows that MK का दो तीन क्वेश्चन था, वो स्टूडेंट ने कितना आंसर किया, accordingly he gives the marks. And if the failure to answer the first question, no further chance for the same question is given. You can ask him to pick up another card, but no second leading question for that. I will come back to all these slides again, okay? Because you can face to face, you can ask me some questions. The examiners generally should not show anger or maybe, some hurry, and they should not show expressions. So students get little worried. You agree with me, all of you?
Yes, ma'am.
Each examiner should have equal time. If it is decided to give 8 minutes for a candidate, 4, 4, 6 minutes, 3, 3, each question may be marked individually and summing up at the end. And question answers and scores are noted concurrently by the examiners for each candidate. They are doing as their question is answering, you concurrently score and mark it. So you don't forget it, do it later. So now, is the question clear? Is it short? Is the question precise? The students will not misunderstand the question for some other thing. Cover also, I asked Arun, Define implant. He rightly defined implant as a one of the body, parts which are artificial parts which are. So I didn't ask him about oral implants, but I meant to ask, so I got angry. I say, are you a orthopedic surgeon? I want you are a dental surgeon. Cover all subtasks, what is to be done, demonstrate, mark, etc. Have a bell in proper sequence or have a timer. Ask the questions in proper set. Test all levels of knowledge. Give standard set of questions to all examiners. Every examiner should ask one MK and at least one, the nice to know and desirable to know. He must ask all at least one MK each or two MK, you can decide. And you can decide that if there are only six questions to ask, then I will ask two MK and only one desirable to know. You can ask the nice to know. I don't have to ask about stem cells to a BDS students. They must know about it. But I don't want to test my entire examination on that. So prepare standard marking scheme and keep the Viva card ready for every student. द वाइवा कार्ड एक कौन सा MK था, कौन सा नंबर था, what is the score that you are desiring. See, if you say 0 to 5, all of us write 3 in a very short answer. Everybody gives out of 2 1. These are all not way of examining. It's not assessment. Some more clarities I will give you. The questions are constructed by a group of faculty with the inputs from all those who have participated in the teaching process. You can validate it by giving it to the students, without telling them anything, or the students in third year question can be given to the final year. Some interns can answer like that. A number of questions from each topic, the content area of the difficulty, varying difficulty levels among the learning object. In MK itself, I can ask higher and higher difficulty levels. In NK and DK, if I go for very high difficulty levels, it's not fair for the students. Also validated from teaching staff in the department, whether they understand the question, whether the question has answered the purpose for which I am asking. Okay? Just asking them discuss. There is no meaning to discuss. What do you understand by centric relation? There are people who said, what are the branches of prosthodontic? And whatever the students answer, he will add one more branch. Is there any meaning to that? The questions are then framed to assess recall, must know areas of recall. Mostly recall will be from must know areas. But to assess their problem solving ability in the MK, I will go to the next level of understanding, comprehension, and analysis. Most correct answers for each questions are decided in advance. They are called model answers. Model answer doesn't mean I give comma, full stop, and whole sentence. I give the points what I expect. I expect him to answer define centric relation, both GPT-8, GPT-10, and making him even understand why the GPT-4 said that way. What do you mean by this? Does the mandibular position changes by changing the definition? No. It is the way we have understood, we are interpreting that is changing. It was such a simple definition. Posterior most unstrained position of the condyles in the glenoid. That position is posterior most only till it is unstrained. If it is strained, it is not. We are all coming back to many things what was used formerly. And most correct answers for each questions are decided in advance. Marks allotted. Some leeway can be given to the teachers during the postgraduate examination, but that also a limitation, because what I have not decided, I may make it up during the time of the Viva if I want to be a tough examiner or a lenient examiner. Marks allotted for each part of question, the weightage, the importance, and is according to the difficulty level is set up. Okay, last time we did talk in blueprinting about the weightage. and the frequency table we saw. Each question is typed on the card and not written, so that you can put it in the boxes of defined domain and of the defined domain. Supposing I have a box where all recall questions of MK is there, the second box can be made for the understanding and comprehension, third for analysis. So I don't repeat the recall question. I can ask him to take a recall, one and understanding, one and comprehension. I'm further elaborating for you. It's not only three boxes, but in MK, I can have different levels of the boxes. And if I really want to differentiate between the students' ability, understanding, comprehension, and his level, the last bit what intelligent students need to be defined and said that he is the topper, that part comes over here. A number of questions are made for every topic and they are collected. Make a large series of cards and on each card write one question or type one question, I will say, because handwriting can be misleading. Divide the cards into groups. Each group is representing one section of the course. Check the wording by reading the question to your colleagues and make sure they understand the question as you have intended to. Validity. I intended to know the composition of irreversible hydrocolloid, but I asked him not the composition, but I asked him some other question. This is a very crude way of explaining you, and I expected him to write composition as well. I said, now, what about the expansion of the irreversible hydrocolloid? I expected that he will give me the composition and then answer. So this is me who is now. So now let's see some questions. MK, NK, and DK. We have complete denture prosthodontics, removable partial denture prosthodontic, fixed partial denture prosthodontics, maxillofacial prosthodontic, implant prosthodontic. See, let me tell you one thing. This way of dividing should change. What do you mean? Is this complete denture prosthodontics determines the technique determines the patient need, or the patient need determines this prosthesis? Come on, tell me.
The patient needs, ma'am.
And then we say, I have learned implant, so I am going to do the implant for the next patient. It's completely not ethical at all. I'll come to that. If you make me speak about prosthodontics, there are lots of changes which is needed to be done, and so that's why I don't speak about it. People don't make the changes because I have tried myself. Okay, now I have marked MK here but not put anything in MK color purposely. Tell me which are the MK questions here. Must know. Start. One by one. Each one
Muscles of mastication.
is a MK question. Okay.
What is
Select.
abutment?
Okay.
Landmark again. Must know question.
Which one?
Landmark.
What is spacer?
Madam, Apple gets rules.
Okay. So is there any question which is not MK here? Don't you think all are must know areas?
All are must know areas, man.
Exactly. And if I have difference with Anand and Arun, that no, these are all nice to know, these are all desirable to know, it's just a futile fight, that's all. So first and foremost, a common agreement has to be there between the faculty members in the department, and so that's why the head of the department is the chair who gels and connects everybody. So tell me which are the nice to know question here.
What is the
What
fulcrum
is
line in the removable partial denture?
It's not, is it a nice to know or it's a must know?
I think it's nice to know.
नो फल्क्रम लाइन नहीं मालूम पड़ेगा तो उसको इनडायरेक्ट रिटर्न प्लेस करने में भी उसका द वे ऑफ how it is lifted up and all those things also will be a problem, no?
What are the preferred teeth used to support over denture, madam?
What are the
Biologic
preferred teeth
dentures
used to
next
support
to
over? Okay, that's a nice to know area.
and biological dentures also next to
When
What
you
is
How
say,
should be
Facebook?
the tooth
What is
preparation?
Facebook?
okay, what is Facebook is a very irrelevant question also for undergraduate student. If you say orientation, relation, and what instrument is used for that, it has some meaning. Ants law is a must know area.
Yes, ma'am.
Yes, ma'am.
Indirect retainer, define indirect. What is means? What do you mean by what is? The question itself is not structured.
Yes, ma'am.
Let me show you one more. Desirable to know. कौन सा है?
What is geriatric dentistry? What changes you see in the partially dentless geriatric patients, madam?
What is spring bridge?
Right. I wouldn't even ask such question. Yeah. What is this question? What are various options to replace natural teeth by fixed prosthesis? BDS. Obturator can be a nice to know, nice question, no? Geriatric is a very nice question.
Yes, ma'am.
Now I want to test him more, higher level, so I can ask a diabetic patient reported for complete, right? Are you getting what am I coming to?
Yes, ma'am.
Yeah.
Yes,
So
ma'am.
now can we prepare a scoring card? Yes. Student name. I took the first viva of Siddharth. Allotted evaluator 1, evaluator both 2, both I was. And here I am giving out of 25. And Arun, I evaluated both as evaluator 1 and 2. And here I am suddenly giving marks of 15 because I like Arun. Arun, say thank you.
Thank you, ma'am.
Siddharth, I'll give you 20, don't worry.
Okay, madam. Thank you, madam.
So, this is what is important. What is your each? The scoring paper are different for both. And I also here have one more column added as to must know area question ka, which question he took up and how much marks I'm giving. That we will have to add. So in a conventional Viva, you have a common sheet like this and you just add up. There is nothing in it. So other aspects which you can make the students understand and improve them, as I said, in the language, the fluency, the confidence what he gets during the viva carries a long way for his practice as well. He can be expressive without showing much of the facial expression by language. You can have a rating scale with agreed examiners. So you can have rating scale. Supposing 0 to 10, you can have a rating scale whether he was adequate, inadequate, or satisfactory. And after Viva, take feedback from peers, students, and teachers to critically evaluate the performance. This is my performance as to how did I ask the questions, and I am taking a feedback. And the students need to be given a feedback. Feedback is always two-way. And recycle the Viva question project by planning and re-evaluation. So it's a lot of work, you see. A Viva is not just I go and take an exam.
Ma'am, what is the meaning of last line, ma'am? Recycle.
Use the questions again
In the
and
same exam,
say
same
no,
exam or
no. This is when I am planning my. This is like a project. If I take a project, not educational project, department project that I have been allotted to prepare Viva cards by my HOD. And I am
okay.
asking everybody to give me 10 questions, 10 faculty, 100 questions. I'm dividing it. I'm asking these questions to the interns, how they're answering, or maybe to another faculty member. So I recycle it and recycle during the other exams also. And I have a linear thing as to whether the people have understood the questions what I have written. If it's very, very easy, then can I increase the level? Or maybe I start with that and increase. So that is very important. See,
Okay, ma'am.
Viva question, the examiner cannot be asked to even reevaluate. No, whatever I have given is final.
Correct.
So, what are the short term outcomes? To make the undergraduate students aware about structure oral examination. First and foremost, we need to make the students understand how we are going to take a Viva and to increase the understanding of the subjects, to improve the learner's performance in the subject, and to do you understand what am I doing here? I'm indirectly giving you what? Your educational project.
Yes, ma'am.
In the short term, students are briefed. In the intermediate term, the faculty is aware of SOE. The students also get more satisfaction because everything is structured. There will not be discrimination. And in the long term, the students will be confident I will get fair marks. A thing of trust comes in and learners become habitual with a structured oral viva examination. Okay, students feedback is always important. Whenever we are having viva, you can randomly give them questions without their name as to how they felt about the viva. I mean, were they confident, were they satisfied, or the questions asked to them at all levels of difficulty. It's a very good study. So students are individually appraised about the response to a particular question. Questions, answers, and scores are noted by the examiner, I told you. Students do come to find out the lacunae in their knowledge because once the students are confident that they deserve to know more, they will come back to you. So now, what about the validity, reliability, and objectivity of the SOE? The outline scheme makes the oral test objective because there is no subjectiveness of which, whether English speaking, fair looking, or dark, or maybe some other language speaking, not able to, not, there is nothing. So it becomes more valid and reliable. And because the questions are prepared in advance, the educational objectives are clearly defined. If I ask a question on resins, I know that the objective is not only to know the composition, but the manipulation, but also to know the effects of the allergies that people can pose on the resins. So my objective is clinical, my objective is higher. Because the candidate selects his own questions, there is no bias. This parallel marking ensures between the two examiners that everything will be fair. In conclusion, I want to tell you conduct oral examinations without any bias because this is a very important component of assessment. It inculcates in the students fast thinking, quick thinking, clear expression, and intellectual honesty. It has special place in dental education because the competence of a doctor is judged by his patients so frequently from the way he talks. So here I conclude my presentation. I will stop sharing the screen and we can have the question. Is it a good food for thought for you?
Yes, ma'am. Ma'am, I have few questions, ma'am.
Just wait, let me stop sharing. I stopped sharing, but it's not becoming stop sharing.
No, ma'am,
Ma'am,
just
it's stop.
stop sharing, madam.
Stop हो गया, ma'am.
We can see.
Yeah, that's not enough. No, I have to see. Okay, I'll just switch on the light here. Just Okay, shoot.
Ma'am, we need to, if we
Ma'am,
have a 40 candidates, do we have to make the cards for each candidate? That means to say the total of 40 cards.
no. The question is now 40 cards may not be enough. You have such a wide, so you can have a box for maybe. See, if you ask me, let me now intervene here and tell you that all along prosthodontics has gone according to the prosthesis and it has not gone according to the patient condition. It has gone on fixed partial dentures, it has gone on complete removable. Situation is important. The patient is not a person or a thing that you can give anything you like. Why Arun is not there? Mirna not there?
Ma'am, I'm there.
Okay, okay, fine, fine, fine. Okay. So now, apart from that, what I want to tell you is making the cards for every topic. If you have 10 questions, 12 questions, 20 questions also, we have so many topics. 40 is not the question. The question is you can make hundreds of questions, but it has to be done slowly. This year I start with making complete denture, say 50 questions, maybe 50 in the removable partial dentures, because that is how the examination system is going. And fixed the so many, and at the level of the learner of the third year, final year, second year, accordingly, I will make the separate Viva cards. I will have the colored cards and put them in a box. The student picks up the card, and from the MK box, he picks up in one subject. Then he can pick up in the second subject. In one subject also, I have recall questions of all the subject. Say complete answer. I can have recall questions. I can just ask him about the elevators of the mandible. Which are the two heads of the lateral pterygoid? What about the medial pterygoid? These are all questions not so easy for him because though he has learned in anatomy in the final year, he might have forgotten. Encouraging him to understand the muscle attachment, insertion is very important. This is what the examinations abroad do by giving you a situational analysis. He says the patient's mandible is, rotated towards the left and the patient is unable to take it. What is the condition of the joint that you feel? So the student thinks of so many things. He thinks of the joint, thinks of the muscle, he thinks of what has happened, or maybe a pathological condition. So many things. An occlusion, what happens? So this can come only later. But here I want you to first and foremost get into your groups and make 5 Viva cards. No recall, we can make in understanding, comprehension, and analysis. And group 1 will do complete denture, group 2 will do fixed partial, and the group 3 will do removable partial. Unfortunately, our exam is like that. But please understand, today it is not that we need to go like this. People have understood this and people are changing their ways. Books on complete denture prosthodontics is specialized, made by that person who has all the time, written by the person because he's all the time worked in that. Now no one works so much on only one thing. It's depending on the condition of the patient that I decide. So a common clinic starts from your second year, and everywhere they have common clinics where everybody, a periodontist, a prosthodontist, an endodontist, maybe a radiologist, everybody is there. So the discussion of the case, patient, and not discussion of the prosthesis. Prosthesis is important. The prosthodontist will advise. This is okay. This change is very difficult to bring in our country. It's very difficult. So, and it will come. It has to come. Will become mandatory one day. So, what I am requesting you is take. I'll give you a break for 10 minutes to make question individually on your own. Make one NK, and one DK at different levels. MK you make, if you want to make must know areas, make at the level of maybe structure it properly, the question at understanding. You can put on comprehension, difference between so analysis, that question, each at least one of each one of you make one MK and one nice to know area, and see, let us see in 10 minutes, it's 7:15, 10-minute break you can take, and at 7:25 I will, so that we can discuss on that, the more clear it will become. Then when you prepare in the commonly on the colored cards what you have. Okay. Okay, take a break not for tea, huh? Break for preparing. So, are we ready?
Ma'am, I have posted few questions in the message, ma'am.
Okay.
Madam, shall I finish, madam? First.
Ma'am, can I go? Can I go ahead?
Yeah, please tell.
Ma'am, I have prepared the question according to Bloom's taxonomy. Uh, I will go with that question first, then I will go for the must know, nice to know, and desirable. So, for the Bloom's taxonomy, like recalling the things what the student have read. First question is, what are the stress-bearing area of the maxilla and mandibular retentulous arch? And then understanding whether the
In a viva, you want to give, supposing, say, I don't know how much it is for, say, 20. So the number of question you ask and the MK questions are 2 marks, then you should give him enough time to answer at least for one. Or unless you want to give a higher level of where the stress bearing areas are for mandible and maxilla. Think about it. Yeah.
I have just prepared the question to name the questions only.
Okay. Okay. Fine.
Then, if I'll go for the understand to know the understanding of the students, then my question will be, why a spacer is used in the custom tray for this? Why a spacer is used in the custom tray for the stress bearing areas?
Okay.
And for the applied aspect, I'll twist my question that if in the anterior maxillary region there is resilient soft tissue is present because of the resorption, what spacer design are you going to choose for this patient? So the student has to apply the knowledge based on the different type of spacer design and choose what type of spacer design he is going to use.
Anybody wants to give any input regarding the third question? Any inputs? Did you hear our questions?
Kindly repeat the third question, madam.
So there are some people who have put here questions. I think Siddharth has put desirable to know luting agents for cementation of fixed partial dentures. Is that a desirable to know? Okay. And then nice to know different types of metal-free ceramic crowns. Then must know is list out the principles of tooth preparation. Any changes you want to make in the structure of the question? Please see his question in the chat. He has put.
Ma'am, I have one question left, analyzing type of question in the same subject. Can I go ahead?
Yes.
If a maxillary cast, I'll ask the student that I'll provide the student with a maxillary cast with two retained canines,
Ah,
and I'll ask the student, I'll give the OPG to the student as well as the cast and ask the student to go ahead with the treatment plan.
okay. All right. So what you do is, Mirna,
Yes,
you
ma'am.
define your questions and put it in the WhatsApp group. Let everybody see. Let everyone has to put three questions in the WhatsApp group. It just put what level and what area it is. Nice to know or nice to know.
Okay.
Everybody can put. So who else is sharing next?
Ma'am, Arun sir has said, madam.
Ma'am, it's in the group message, ma'am, the Google Meet group message.
Okay, 1 minute. Hello. अच्छा तो ठीक है, मैं उसको बोलती हूँ, ऐसा नहीं चलेगा, हम लोग को जाना है उधर. ओके, मैं बात करती हूँ. ओके, या हाँ, या have you pinned it, Arun?
Ma'am, I've sent it on the WhatsApp message as well.
Okay, read, Arun.
I must know it's under fixed partial denture category, ma'am. I made must know what are the indication for fixed partial dentures. Nice to know. How does the choice of abutment teeth affect the success of fixed partial dentures?
So do you think he will answer indications for fixed partial denture in that half a minute to 1 minute? Write a model answer for that. Then we'll discuss. Okay? Yeah.
Okay, ma'am.
How does the choice of abutment teeth affect the success of fixed partial denture? Okay. What do you mean by nice to know? The recent advances are nice to know. The recent developments are nice to know.
Okay,
Some
ma'am.
so nice to know. Does this come in nice to know, Arun? It's a very good question for must know. Choice of your abutment. And desirable know is in between nice to know and must know. That it is desired by the students to know this. That's why I said the gray area is too much. There is no boundary.
Ma'am, desire is to know is more difficult than nice to know.
Yeah. At
See,
one
the
point,
the main area center is
ನಮ್ಗೆ
must
ನಾನು ಚಾಕರಿ ಕೊಡು
the around the
ಎದಕ್ಕೆ
area
ಇದಕ್ಕೆ ಬುದ್ಧಿ
is, see, there is one thing must know. I will just explain the verb to you. He must know it, otherwise the basics are wrong, he cannot practice. The next level is these two areas we need to find out. Can you, I will just Google and see.
Ma'am, the order of precedence is must know, nice to know, and desire is to know. That is
Okay,
level 2 is nice to know.
okay. But you tell me the nice to know, because when we were doing, they said nice to know long time back. I never seen any this thing after that. Nice to know is it is nice to know about few things which are recent developments and all these things. So I think there is a gray area between desirable to know and nice to know also. We will look into it. But I am asking you, the abutment, choice of abutment is a must know area.
Okay, ma'am.
madam, in a major part of the curriculum, whatever we have gone through, like syllabus of different universities, there are only two parts, madam. One is must know, one is desirable to know. Like as you said, if it's nice to know, it has to go towards the recent advancements, madam. Let's say, madam, just now when I framed
No,
the
but
question,
we will keep it open. Let us as teachers be open minded, look into the literature and keep it. Otherwise, it's very, see, they say listening to the 10th man is important because the group of people and everybody has different ideas. If as a leader I can take the ideas differently and take it healthily, it may improve my strategy. But I, moment you oppose me, I say just shut up. It doesn't improve.
yes,
And we have not been taught this. So education teaches you that.
yes.
Okay. Arun, go ahead.
Ma'am, under desirable to know, I have written what are the digital techniques in the fabrication of fixed partial dentures.
Okay, you can make answers for that model answer points.
Okay, ma'am.
So yourself will refine it and yourself will say which area it belongs.
Okay, ma'am.
Anybody else?
Rohit has uploaded.
Yeah, ma'am. I uploaded, ma'am. In must know, I kept it like define complete denture impression.
Ah. So why complete denture impression define?
Because when we are asking why in that, we are expecting our student at least they know complete denture impression nicely.
Define
Because
impression.
yeah, you know, sometimes they are getting confused in impression and complete denture impression. So that complete denture impression is totally different from the impression when we are expecting. They have to answer that GPT definition what we are having.
Anybody wants to give any input, you can write the answer and see.
Okay, ma'am. And ma'am, in nice to know, at least if a student is aware about the recent advancement of impression making.
See here, we are not debating the subject. We are only trying to understand the Viva card concept, how to make. Because if this a medical person is taking, she would not even know, he or she, what is the fabrication of a fixed partial denture, isn't it? And remember, if you are asking this for a final BDS student, let us make 1 year fixed. Let's ask for final BDS and make later on we can make it for MDS. So if it is for final BDS, what are you testing? What you are wanting to test is knowledge, or what you want to test is skills. And how will you frame the question? How will you elicit the right thinking of the student? Shilpa, you want to share?
Yes, ma'am.
Bolo.
For must know category, ma'am, define and classify articulators. For desire, nice to know how to transfer the FACEPO and how to operate it on the HANA articulators. And desirable to know is what are the parts of an HANA articulators for a final year BDS student.
Okay. What is the aim of asking the different parts of an articulator? What how does it increase his knowledge? Think
Um,
while making a question, how does it help? What are you testing? What is your aim of testing this? What do you want the students to go ahead and understand?
but ma'am, according to the syllabus, ma'am, the university gives us the statement that at the end of the course, the students must know these and these X and Y Z of the articulators. So based on that, we have to
I
frame
understand.
a question.
There's a whole
Yes,
lot of
ma'am.
things the university gives you
Yes, ma'am.
at the end of the course. We are not able to do everything. So
Yes,
why
ma'am.
the weightage is given to a now articulator in particular? And has the students been shown that?
We will be giving a demonstration, ma'am, for final year students because we will be asking questions. What directly on the day of Viva? What are the parts? Like by looking at the HANA articulator,
Every
the
year you
student
do that.
must
Every
be.
year you do that.
Yes, ma'am. For a final year students, videos just before the
What is the frequency
final year exams, we will do.
of using henna articulator in private practice for a BDS student? What is the weightage? What's the frequency? There
BBA
is
students may not less.
blueprinting comes in even Viva.
Yes, ma'am.
For the first attempt, you have made very good questions, all of you. But at least the whole concept of structured Viva is understood.
Yes,
Anand, you
ma'am.
want to share? Can't hear.
Yes, madam. I too have prepared, madam. Under the must know, please. Under the must know, madam, I made a definition for posterior palatal cell and functions of posterior palatal cell. And under the desirable to know, madam, I made importance of balanced occlusion and factors affecting balanced occlusion in complete denture. And under the nice to know, difference between clinical remounting and laboratory remounting in complete denture, madam.
The posterior parietal seal question can be restructured. Just check.
Okay, madam.
Rohit, you want to share?
Ma'am already told that last
Siddharth,
question is,
last question.
uh, ma'am, last question was there in desirous to know objective of impression making.
That is a must.
I want you all to write an answer so that you yourself will make a modification. You are realizing as teachers and assessors, we are shooting questions, but we have not answered them.
Yes, ma'am. Ma'am, this term desirable to know and nice to know, they sound similar to me,
I
actually.
understand, so we will look into it.
Yes, ma'am. But ma'am, in RGHS, they have
Actually,
given a
when we were
must
doing
know,
so
should
many
know.
in 1998, when this started the concept of all this in India, they told
Yes,
us
ma'am.
must
Yes,
know,
ma'am.
should know, and nice to know.
And nice to know. Yes, ma'am.
So should know comes very close to must know.
Must know.
Must know.
And then they said nice to know. The desirable to know is a newer concept. I'll look into the whole thing and let you know. Because for more than that, what you ask the questions. See, the student should know about jaw relation, the vertical relation. The student should know about centric relation. He should know how to record VR and CR. He should know about maximum intercuspation position. He should know ICP and all those things. And he should know about temporomandibular joint. He should know about muscles of mastication. When I ask you quickly about lateral pterygoid, he should know because the movement of the muscles, the jaw is important. And when I ask him certain things regarding in removable partial denture, the designing part, the various component parts, the fixed part, these are all the must know areas. But when I am trying to be a smart examiner, I will structure the question correctly to so that students can answer. What is the objective of making impression making? The student will think, okay, you are asking what is the objective? It must be different than what your negative likeness or whatever you say. Uska kya uska usko answer. You're only testing his ability for the language as well. And frequency. Even in nice to know, I would like to capture an area where he is able to, it will be useful in the practice. And asking a nice to know area, the henna articulator component parts and marking is okay. But in that case, have you kept a model or you have kept a drawing? That also you should know. He can only name them. Viva can be taken in very many ways. It's just not oral viva. It can be marking. It can be showing you on the map. So now, when you prepare questions and present to me, next time is your last time's uh, assignment. What was that?
Critical evaluation, madam. The blueprinting. Sorry, madam. It's blueprinting.
Uh, what about in blueprinting? Please post in the WhatsApp group just now what is the assignment given to each group. Talk to you, and before 10 o'clock today, please post it so I can post ahead what is my mind. And also, next time you will all present question with a model answer and you will come with a paper or make a PowerPoint presentations. You can present it to me as a group. Different color. The background can be pink, it can be yellow, it can be gray, it can be purple, anything.
Ma'am, what the task you have assigned, can you please repeat one more time, ma'am? Last time the task you have given, we couldn't actually understood the assignment.
It was on blueprinting. You
Yeah.
all together had to present one time. So
No,
I
ma'am.
said
Further, you have divided into three groups. The
three
first
groups.
group was assigned the task on the dental regime, denture-based regime.
Yes.
But what we have to do on that?
If you want to ask a question on dental based resin as a topic on one side, what level you are going, what is the area you are testing, whether or how is the instrument, short answer, long answer, or maybe it is a MCQ. So prepare question accordingly.
Oh, you mean to say all possible variety of questions based on that chapter?
Yeah. So whichever topic, I don't care what topic you take. I said one person take on materials like resin and composite resins. Resins are not just only denture-based resins. It can be composite resins. Then one on removable partial denture and fixed. I think group two was fixed and group three was removable.
Yeah, group one was assigned regarding regime, ma'am.
Yeah. So you can do that. And similarly, only blueprinting of Viva OC you have to do. So combine that, but always have a model answer so that you come to know whether the question asked is right or not. Yeah. So shall we call for the day?
Yes,
Any
ma'am.
questions? Any input on the session?
Ma'am, showing face is required in Viva OC. Like we can put a board across a mic because we can't see the color, can't see the sex, or can't see at least
No, no,
to an
that is
extent
important.
discrimination.
So important to have a human contact because eye to eye meeting with a positive attitude is expected from examiner and student. One, if when your videos are closed, I'm speaking to the wall. I don't have that kind of passion, but involvement is there when you are all with the on and I think you are all listening to me. Otherwise, I can think, okay, somebody is practicing, somebody is doing some cooking, or somebody is doing something. A short break of 10 minutes to eat or drink is okay, or to go to the toilet is okay. But continuously not switching on the video, it's not nice. Similarly, in a Viva, if at all, I am only speaking to the black curtain or a green curtain, it doesn't motivate me at all like an examiner. और इतना भी हम लोग खराब नहीं है कि हम ऐसे इसको देख करके मार्क्स दे देंगे.
Madam, any time frame is there particularly, madam? Let's for
Time,
being time
see,
frame for Viva.
to check a candidate, no, you should have at least 8 minutes and 2 minutes of debriefing. It has to be there. That is why they say if you have 3 hours, you can test only 20 students.
Yeah.
10 minutes and in between the students coming, going, and other things. And in bit lesser than that, there is no reliability and no validity. Then reliability is not that there is no validity, there's no objectivity. I think we will to next time talk to you about reliability and validity. There is some doubt in your minds. We'll speak about that clearly. What is validity, reliability, and then we will ask you to present, and then we'll conclude the session. Is that okay? I wanted some input regarding today's session. Did it highlight certain important things which you were doing knowingly, unknowingly? And what did you feel about all the process that we have been doing these years? And the session, did I criticize anybody in it or it was general? My feedback also.
Ma'am, till now we were doing generalized, ma'am. What comes to our mind, we were asking. So now at least we know what should be we should be asking. At
Yeah.
least realization is happened way bit so that we can graduate on that and improve upon on us so that we can expect something out of the students.
Realization is the first step. You're entering the room, the door is open, and now the sky is the limit for you to make the Viva questions. And I think for your entire faculty, we should address and tell what is SOE. We had done that in few colleges online, we did last year because we felt even the medical and dental, everybody was present. So what we did was we had a presentation. We made them work in groups. Is a Zoom call. We can break out rooms. They all presented, and you present. Next time, I will put a Zoom call for 45 minutes. you breakout rooms करेंगे, then you join the same link what I send you for 45 minutes. So वैसा 1.5 घंटा तो हो ही जाता है. And 40 minutes it gives, we can join even 3 times. There is no problem. Because Zoom is a better this thing. We started with this web, this what it is,
Webex. Webex.
WebEx. WebEx is a good medium. WebEx doesn't have so many these things also attached. But somehow that WebEx expired, so we are just trying out this. But we'll do it. And next time we will discuss. So that one is realization. Second is we were not even as a teacher exposed to it. So it's not your mistake. Third is I did take out lot of points of what we have all been doing. I did not say that X is doing or Y is doing. So, in a lecture, it's very important not to pinpoint and be subjective and personal. Thirdly, where are the scopes that we can all join together and improve is the faculty of the department getting together. There is no one who can walk the path alone. If Shilpa knows a lot about education and others don't know, you can't use it, Shilpa. So that is the way. Why? What is Anand doing? Anand, patient treating is not allowed. Huh? Okay, we call it a day. Let him treat the patient. Rohit, will you find out what is he doing and tell me?
Okay, ma'am. I will find out. I'll ask him after some time.
Yeah, yeah.
Yeah.
Uh, Anand, bye.
Ma'am left. I think it is session is closed.
Yes. Yes, sir.
Sir,
Yes, sir.
before session is closed, madam, Minna madam, who are the group members, madam, this time? The
One, two,
same
three,
group.
first group. Mine
Same,
is three. I don't.
same, which was decided. I think, ma'am, one slide ma'am had given constructive alignment का उस पे program and learning
नहीं,
outcomes.
डॉक्टर अरुण लास्ट टाइम मैम ने बोला था रीग्रुपिंग किया था उन्होंने रोल नंबर 1 2 3 दैट वाज द फर्स्ट ग्रुप रेजिन मटेरियल
Okay.
फिर
1 2 3.
5 6 जो था वो था आरपीडी के लिए और 7 8 9 10 वाज फॉर फिक्स परसेंटेज
Madam,
Okay, ma'am.
What we have to do, ma'am?
वही मैं पूछ रही थी मेरे ख्याल से ना जितने ऑल वेराइटी ऑफ आई थिंक एसएक्यू एमईक्यू और जो मॉडिफाइड ऐसे क्वेश्चन ऑल वेराइटी ऑफ क्वेश्चन फ्रॉम दैट चैप्टर
Minna madam, वो नहीं पूछ रहा मैं. 1 2 3 कौन है मैडम? That is what I am asking.
वो
One
मेरा तो
is
ठीक है which
one
one
is one is Anand, two is Arun, third is Minna ma'am.
okay
Okay, the first one.
okay
Okay. 4 5 6 then we have to find out.
So we have to make on resin ma'am.
yes Dr. Arun so what we have to decide that who will be doing the MEQ who will be doing the MCQ and all those things or else we all can do two questions from each variety and then merge together.
Okay, MEQ, SEQ, and this is based on the blueprinting, na?
Yeah, not blueprinting exactly. Ma'am was telling that we have to prepare all variety of questions from that chapter.
Oh.
So I think Dr. Arun, we'll each of us will prepare two questions from each variety, then we'll merge the questions together.
All right, ma'am. As ma'am said, we will put up what is the assignment because the confusion is in what is the assignment is. Making the assignment is easy, but knowing the assignment is difficult.
Yeah, from the last class onwards, I was confused about what was the assignment. I knew only the region, but what to prepare from the region, I didn't know. So
So shall we
Yes.
put it in the group so that ma'am can clarify and tell us?
yeah, you put it in the group.
Okay, ma'am.
So four,
Okay.
five, six.
Bye. Good night, everybody.
See you, ma'am. Bye.